Hello, everyone. So at least anniversary of the country lockdown since the pandemic outbreak, I would like to talk about this topic, health in America. What explains the variation in COVID-19 mortality rate across the United States? So in this chart, I show you the cumulative county COVID-19 mortality rate, which is the number of the deaths due to COVID per 1 million population as of January 23rd, 2021. The blue color represents a low mortality rate, and the red color represents a high mortality rate. The darker the color means either very low or very high mortality. So it is very clear that there's a wide variation in COVID-19 mortality rate across the country. So in today's presentation, I would like to show you what factors explain this variation. Some might say that this wide variation is driven by some small counties with very few population. So it might not be representative. So in this chart, I show you the mortality rate for the 30 largest counties in the United States. So on the left, we can see that number one county with the highest mortality rate is Bronx County in New York, with 3,800 deaths per 1 million population, followed by Queens and Kings counties in New York. In the middle, Los Angeles County has 1,500 deaths. On the right, we can see King County, Washington State, which is Seattle region, and Alameda County in Bay Area had much lower deaths, 500. So in short, the wide variation of mortality occurs in the most populous counties as well. So in this chart, I show you the cumulative county COVID-19 confirmed case rate per 100 population as of January 23rd, 2021. And the red color represents high infection rate, while the blue color represents the low one. Again, we can see wide variation of COVID infection rate along with several clusters in Midwest, Mississippi Valley, Southwest, and California. Note that there might be some measurement errors of the case rate because some people might have contracted COVID but without any symptom or had never been tested. So even we also analyze which factors contributing to the variation of the infection rate. Our main focus still on the mortality rate because we believe it is less contaminated by possible measurement errors. So in this chart, I show you the correlation between the confirmed case rate and mortality rate of a county. So the horizontal axis is the case rate and the vertical axis is the mortality rate. Of course, we can see a strong and positive correlation between these two variables. Here we calculate the so-called case fatality rate, CFR, which is simply the mortality divided by confirmed case in a county. So in other words, if you look at the chart, those blue dots above the red line, average line, are having higher case fatality rate, while those below the red line are having lower CFR. So in this chart, I show you the case fatality rate across the country. The red color means high CFR, and the blue color means lower CFR. And again, there's a wide variation of the case fatality rates across the country. Note that some regions, such as New York, New Jersey, Massachusetts, Michigan, Georgia, have higher case fatality rate. And one reason is because if we still remember that, they got hit first in March and April last year. And because they are the first wave states, when we were less prepared to fight against the virus. So we need to factor these first wave shocks. So let's talk about our research methodology. We use so-called multivariate regressions to find the significant factors which are associated with COVID-19 mortality. We try 7 model settings. We analyze not only death rate, but also case rate and case fatality rate as dependent variable, also called Taki variable. For explanatory variable, we include variables such as age, race, socioeconomic, industry, and health factors at a county level. The age, race, socioeconomic variable are from American Community Survey in 2019. Industry variable are from QCEW in 2019. And health variable are a couple of indicators selected by county health ranking data. And in the model 7, we use cumulative mortality rate on May 31st, 2020 as an indicator for the first wave shock, as I mentioned previously. Okay. So here I show you the significant factors to predict this COVID-19 mortality. So know that different model settings might suggest different significant factors. So I learned this lesson from my colleague at Limer. So I need to be very careful. So the predictors I select here are persistently significant across different settings. So we can say they are very robust predictors. So on the left, I show you the factors which are positively correlated with mortality: age, human capital, education. So I will explain more detail for these two factors later. Early stage hit by first wave, poverty. So that is a county with more residents living in poverty would have higher COVID mortality. That is not surprising. So nursing home exposure. So we had heard many tragic stories happen in the nursing home. And now it is confirmed by our empirical evidence. Indeed, a county with more nursing home capacity has a higher mortality rate. And these are two health factors. Excessive drinking behavior is associated with COVID-19 death. And this is another very important health factor: premature death before age 75 due to all kinds of disease like cancer. And know that this is a measurement based on 2016 to 2018 data by county. So this suggests that a county with less health capital before the pandemic will have higher mortality during the pandemic. And minority group has a higher mortality rate. We will explain this in more detail later. On the right, these are the factors that are inversely correlated with mortality rate. Disability insurance. A county with more people with disability insurance will have a lower mortality rate. That is because they are less mobile and therefore are less exposed to the virus environment. Public health insurance. A county with more people with public health insurance, such as Medicaid, has lower mortality, simply because they had more access to healthcare resources. Work from home. So a county with more people working from home, of course, will have lower mortality because they are less likely to be exposed to the virus environment. And this is a very interesting variable: percentage vote for Clinton in 2016 presidential election. So this means, I think, a county with more residents voting for Democrat would have a low mortality after controlling all other variables. Yeah, this is very important. So what does this mean? A county with more percentage vote for Democratic Party means, I think, two things. One is local government is more likely to use stringent mitigation policy, such as wearing masks or social distancing. And two, residents are more likely to obey the rule. And we believe these policies and behavior are associated with lower mortality rate. And finally, computer access. So this is a very interesting finding as well. So what I have shown you so far are more or less consistent with the recent literature and study. But this is a new variable. I find a county with more access to computer or broadband or internet has a lower mortality rate. Why? I think because computer internet capacities, with that, residents are more likely to do telehealth. Laila will talk about that later on, and more likely to order grocery, prescription online, and more likely to work from home, as we just mentioned before. So all this could lead to lower mortality rate. So here are the insignificant factors. We saw they might explain mortality, but it turned out to be they do not. Population and population density. Let's say the pandemic hit a big, small, urban, and rural area equally. Median income, labor force participation, unemployment rates in 2019, not significant. Industry employment percentage density from next sectors. For example, meat packing factory. So this is because we heard a lot of stories about high infection rate in the meat packing factories. So it is not significant. Airport, leisure and hospitality sectors, not significant. Office of physicians, which I believe represent the healthcare resources, not significant. Supermarket, grocery stores, not significant. So on the right, health factors such as poor physical health days, smoking, food environment index, physical inactivity, all these are not significant predictor for COVID-19 mortality, at least in our data sample. So now let's dive into three important factors. First, age factor. So in this chart, you can see age 85 years old and above is the riskiest group compared to the middle age 35 to 54. Age 85 and above has much higher mortality. And age 75 to 84 is also high risk group. To my surprise, age 65 to 74, in fact, has a lower mortality rate than the middle age group. And I found out it is because they had a much lower infection rate. Perhaps they are more extremely cautious and they are more likely to be retired and stay at home compared to the middle age group. So in this chart, I will show you the correlation between the education and COVID mortality. So the horizontal axis is the CT Human Capital Index. The index, if you guys remember, we developed several years ago, which is the weighted average of education attainment of adult residents. So we can think 1/10 of the index is like an average schooling years. And the vertical axis is the mortality rate. So we can see that counties with index above 140, which is about 14 schooling year, have a lower mortality rate than those below 140. And the reason could be that more educated people are more aware of the virus, and they are more likely also to work from home because of their occupation professions, and therefore reduce the risk to be infected. So I also found once these educated people got infected, they had the same CFR like less educated people. Okay, so here over the year, we had heard stories and reports from the newspaper saying that minority groups are disproportionately affected by the COVID-19. Unfortunately, that is very true. That is confirmed by our empirical studies. So here I show you Native American, African American, and Latinos, Hispanics had a higher mortality rate than white. However, the cause is slightly different. We found that the Native Americans are due to much higher infection rate, while African Americans and Latino are mostly due to their higher case fatality rate. Okay, finally, conclusion. So there's a wide variation in COVID-19 mortality rate across the country. And we find that the following significant predictors. So factors positive associated with mortality rate are age above 75 years old, first wave states, poverty, nursing home exposure, excessive drinking behavior, comorbidity risk, and minority ethnicity. And factors inversely associated with mortality rate are high education, having disability insurance, having public health insurance, being able to work from home, and having access to computer, broadband internet, a local government with more stringent mitigation policy, or resident with more cautious behaviors. Okay, so that's my presentation. Thank you very much.